let's talk about the spleen. The spleen, all right, is actually the largest of all of our lymphatic organs per se. All right. I hope you all know where it's located. If you've ever had to do a physical exam on anybody, the best way to actually, well, hopefully you wouldn't be able to palpate it. All right, but you have them laying on their back with their knees bent and ask them to take a deep breath in and then just palpate along the costal margin there of the ribs. You shouldn't feel that. If you do, that could mean several things. All right. Does anyone know one of the more common, I hate to call it disease, but afflictions that can cause the spleen to be inflamed? Mono. Nice, nice. All right, good, good, good. All right. So where's the spleen? It's in the left upper quadrant. Has anyone here ever had mono?
Oh,
I probably should be. Really? I feel.
Gave it to me because she used my toothbrush.
Hey, you do some, well, her mom does. Oh, really?
Because she had like 6 kids.
Just use the finger. Yeah, a washcloth. I didn't even think about that. I like that. Use a washcloth. Okay, all right. See, had we been there, we would have told your mom to use the washcloth. So your spleen is located in the left upper quadrant. If you remember from back in chapter 1 there in lab last year, you know, here's your abdomen and thorax there. So it's going to be in the left upper quadrant, which is right over here. Okay. So when you look at the spleen, some people, it's easy to confuse with the kidney because it does have a convex side to it, all right, and then a concave side and then a convex side to it, where there's kind of like an indentation, all right. So the convex side, all right, or the rounded portion, that's going to be on the lateral portion, but more towards the back, and then where it kind of indents here, that's going to be facing towards the midline there, towards your spine, but more towards the front. So that indentation we refer to as the hilum. That's where everything enters into the spleen or exits the spleen. The splenic artery enters into the spleen, the splenic vein exits out of there, and then we'll also have some of our nerves that enter into there too. Okay? So the spleen, similar to the kidney, has a capsule around it made of dense irregular connective tissue. Okay? And of course, if you saw a pattern with the lymphatic, with the lymph nodes there, you saw how the lymph nodes have a capsule around it, and that capsule will invaginate in towards the center, all right? And that's what we see here. All right? Our connective tissue capsule will then extend inwards and create what we call trabeculae. Basically, what that does is that just sections off parts of the internal portions of the spleen, okay? And we name these parts, all right, by what they appear to us, all right? So we'll call it red pulp or white pulp, depending on the coloration of the tissue. So you can see here, all right, in this picture, or this histological slide, you can see here's the white pulp, all right, and then this is the red pulp. And mainly, what gives the red pulp its red coloring are going to be the erythrocytes, the red blood cells, and the platelets there, okay? So what exactly is red and white pulp? Okay. Well, these clusters that we see, all right, are mainly going to be made up of immune cells. And so in the scenario of the white pulp, is going to be T and B lymphocytes. And of course, remember what I told you, macrophages are everywhere. They're just going to be following. Again, go with macrophage if you're not sure. And they all congregate around the central artery there, okay, this structure. So surrounding the artery will be, by contrast, it'll appear more as a white color, and that's going to be made up of mainly the immune cells, all right, the lymphocytes and then the macrophage there. All right, when we're dealing with the red pulp, we'll have, again, macrophages, B lymphocytes. We won't see the T lymphocytes there, but we will have the erythrocytes and the platelets, which will give that red pulp its red coloration, okay? And then we have these two structures, the splenic cords, all right, and that's going to be made up of reticular connective tissue, all right? If you remember from chapter 5 when we were talking about tissues, reticular connective tissue kind of is that connective tissue that makes compartments, all right, little rooms and whatnot. And in those rooms are where we're going to find our cells there, all right? And it could be any of the ones that I've talked about. It could be the white blood cells or the red blood cells and the platelets there, all right? So in those splenic cords, that's what we'll see. And then at the center there, not the center I should say, but the blood vessels, we call them splenic sinusoids, all right? Sinusoids are capillaries, but remember there's 3 types of capillaries, okay? There's the regular continuous capillary, all right? Then we have the fenestrated, which have the wall of the capillary has these small holes in it, okay, circular holes. And then we have sinusoidal, which are the walls of the capillary will have these big kind of look like someone took a big gouge out of it, okay? Great for filtration and whatnot. All right, so that's what we see here in the red pulp, all right? That's where our very permeable capillaries are going to occur. So it doesn't get talked about really a lot, but the spleen, it filters blood. That's basically what it does. Okay, even though it's a lymphatic organ, its job is to filter blood. It doesn't get lymph, all right? It doesn't have a lymphatic supply like from the lymphatic system. Okay, so any lymphocytes come from the blood, so it's going to filter the blood out, all right? But it's also a storage site for red blood cells and platelets. Okay, you don't really think about it, but they'll just kind of congregate there for a little while. Now, a lot of the time, all right, in the filtering process, if the red blood cell is damaged or if it's getting really old, then it'll get destroyed. It'll start the destruction process in the spleen or in the liver there and get broken down, all right? But think of the spleen as a filter for the blood, all right? Similar to the kidney, but not exactly. The kidneys, they do more of a filtering job, all right? So let's do a little bit of labeling here. Kind of show you a thing or two, all right? So you can see here, we're looking at a couple structures that you're familiar with. Here's the gallbladder on the right side, anatomically. All right, your right kidney with the right adrenal gland, left kidney with the left adrenal gland. And then in between, you've got the pancreas here. Here's the duodenum, or the duodenum, okay, the first part of your small intestine. Well, all the way at the end of the pancreas here, all right, by the tail of the pancreas, here's the spleen. Okay, so the convex side is out here on the lateral posterior portion, and then on the internal portion of the medial side that's the hilum here. Okay, and that's where all the blood vessels and nerves go into. So this big red, long vascular structure, all right, that's going to be the splenic artery here. You can kind of see the splenic vein right over here. I don't think that you have this picture, but if you want to take a picture of the spleen here, I believe it is in your soft chalk lesson. Okay, so you can see same thing. Here's the hilum. All right, that's what the circular is representing. That's where your blood vessels enter and exit from the spleen. All right, this black-yellow line, all right, that represents well, it actually represents the spleen as a whole, but right underneath it, this pink region here, that's the capsule, that dense connective tissue. You can see here the trabeculae as it invaginates into, all right, the internal portion of the spleen. And it sections it off into, the red pulp and then the white pulp there. It's not on the soft chalk? Okay. Did you get a picture of it?
Yeah.
Okay, cool. All right. So keep in mind, all right, the spleen checks out blood as it goes through. All right. It filters that blood, not lymph. Okay. It filters the blood. So again, a lot of stuff travels in the blood. All right, obviously, it's not just going to be the plasma proteins, blood plasma, and the cells. Sometimes because the lymph empties into the blood, you're going to get some of the, I hate to say it, the trash, but whatever the lymph filtered out will also be flowing through the blood, which is kind of a good thing because we want to check it and make sure that whatever is in our blood should be there. So that's one of the roles of the spleen, all right, as blood pours through there, all right, it's going to monitor or check for foreign materials and bacteria, okay? So the macrophages play a huge role in that, all right? So we see those in the sinusoids, and the sinusoids are those very permeable capillaries there, all right? We'll see that in the red pulp there. So again, if it comes across, All right, macrophages play a big role in the innate immune system, especially in the non-specific reactions of the internal defenses there. If it comes across foreign debris, it phagocytizes it. If it comes across bacteria, it phagocytizes it. All right, and then from there, it can initiate the immune cell or immune response. All right, with the cell-mediated immunity, but we'll talk about that in lecture. All right. Also, if you have damaged red blood cells or old red blood cells, the macrophages will start to destroy them, and then that's when we see the formation of our bilirubin and the urobilirubin and whatnot, that process, okay? So blood enters into the spleen through the splenic artery. It then travels into the central artery, all right, and down to the sinusoids, where a lot of that filtering and monitoring occurs. And then it's going to leave the spleen. All right, after the sinusoids, it moves into the venules and then eventually into the splenic vein, all right, which then the splenic vein meets up with the inferior mesenteric, all right, vein, and then that will dump into the portal vein, okay? You should know that, right? You guys know that, right? Okay, so functions, I love this, eat foreign particles, all right? Clear the foreign particles or the damaged red blood cells and platelets. And then at the same time, we can store some red blood cells and platelets. Now, in the beginning, early stages of our life, your spleen, believe it or not, along with the red bone marrow throughout your fetal skeleton, all right, well, initially the spleen makes your red blood cells first for about the first 5 months. Then, during that time, all right, as we start to get the formation of red bone marrow throughout the fetal skeleton, then the fetal skeleton takes over the formation. But for the first 5 months, all right, the spleen is making your red blood cells. Pretty cool, huh? All right, tonsils. All right, tonsils are lymphatic structures that are going to be located in 3 regions that you do need to know. You have the pharyngeal tonsils, the palatine tonsils, and the lingual tonsils. When they become enlarged, when we're dealing with the pharyngeal tonsils here, has anyone ever heard of this term before? Adenoids? Yeah, I hear it quite a bit from people saying, oh, my daughter has big adenoids, and that's why she has difficulty swallowing, especially as a young child, because they'll regurgitate sometimes certain food. I said, well, one, she should be chewing her food better, all right, but at the same time, these adenoids can actually obstruct, all right, airflow and whatnot. We'll talk about that later on. All right, but when we're talking about the pharyngeal tonsils are located in the nasopharynx. The pharynx is basically that tube-like structure that's posterior to your nose and mouth. Okay, so the nasopharynx is where the nasal cavity here feeds into the pharynx. Then you have your oral cavity, which will then feed into the oral pharynx. Okay, so when we're talking about the palatine tonsils, think of your hard palate, the roof of your mouth. Okay, if you follow the roof of the mouth all the way back to the soft palate, you know, the uvula, okay, that little punching bag there, right? You'll see down by the soft palate here, that's where you'll find your palatine tonsils. Then laterally on either side, this is the tongue here, laterally on either side of the tongue, you'll find the lingual tonsils, okay? And that's on the posterior portion of the tongue. All right. So tonsils, again, secondary lymphatic structures. What is their job? To monitor, because think about it. When you're breathing air in through your nose and mouth, you're breathing in foreign substances. When you're eating food, all right, you are ingesting or taking in foreign substances. Do you think that there aren't harmful or infectious agents in any of that you're bringing into your body? Of course not. You're pulling that in. So we have, all right, these structures here that are going to surveil everything and check and make sure. Now, hopefully it gets everything. Sometimes it doesn't. No problem, because we have other structures, which we'll talk about when we get into the respiratory system here, that if you inhale them, all right, you got mucosal membranes. Okay? Think of all the defenses, the lysozymes there, and the mucosal membranes, and IgA. The antibody, all right, sits in your mucus. And that will trap these foreign particles. Okay, and if there's anything that can cause damage that is infectious, well, we can get and initiate our immune response there. So in these tonsils, you'll see these little cracks. All right, we call those tonsillar crypts here. All right, it's their job. It's a trap. It's just like in Return of the Jedi when the Mon Calamari, what's his name, General whatever. It's a trap. Does anyone know what I'm talking about? Oh my gosh. All right, no problem. I'm dating myself.
Are those the crypts where you get like tonsil stones stuff there?
No. These are way too small. Way, really small. All right, but that's where we trap that material, that foreign material, and then hopefully, if it is, I shouldn't say hopefully, but if it is an infectious agent, we can initiate the immune response. If it's just something kind of benign, then we can get rid of it. Okay, so our tonsils, similar to lymph nodes, will have some of them that will have those germinal centers. All right, so that's where we'll see our T cells, our B cells, all right, and our macrophages, of course. Okay, if you have your atlas here, you can see, all right, number 17, number 18, and number 19 here. So again, trying to kind of figure out where we are. Here's your nasal cavity. So directly posterior to the nasal cavity are going to be the pharyngeal tonsils. All right, they're located in the nasal pharynx, the upper portion. Your pharynx is pretty much this whole region here. Here, wait, hold on. There's a lot of blue there. All right, this is pretty much your pharynx. Okay, so if it's right posterior to the nasal cavity, it's the nasal pharynx. If it's posterior to the oral cavity, it's the oral pharynx. Okay. So you follow down the hard palate here, and then it gets to the soft palate right at the end of it. All right, that is the palatine tonsils. And then here's your tongue. So the back portion on either side of the tongue, all right, are the lingual tonsils.
Do you have a tonsillectomy so they take out all of them?
Now, usually, you know, it's the latter two, the palatine or the lingual, depends on. Not too much with can we use a T? What did she say? Can we use a T to identify? No. You have to write it out. Yeah, Tracy, you have to write it out, my friend. So yeah, usually in most cases. Now, not to say that they wouldn't take out that if it was issues. My brother had to have his tonsils taken out, and I believe he had his linguals taken out. It was interesting to me, and I don't know enough about this for the research, but he used to get strep throat infections all the time. So if anyone here has had their tonsils taken out, they might have been in the same boat. But as soon as he got them taken out, he wasn't having strep. He used to get like strep throat infections like 3-4 times a year.
Yeah, my daughter is like that. They still have not talked about taking hers out yet.
Oh, really?
She's already had it 3 times in the last rolling year. So
I'm just surprised that
she gets it again. They'll probably send us an ENT, but
How old is she?
she's 10. She
Oh.
just turned 10.
Oh, okay.
Yeah. So, but I've heard it gets more and more difficult as you get older.
Yeah.
That's why I'm like, you know, I don't want to hope that she gets strep again.
Right.
Rather than take them out while she's younger.
No, my brother-in-law's girlfriend, she had, and I had a patient that had the same thing, had tonsils removed, and then, I don't know why she did this all at the same time, but she had her nose broken to straighten it, to fix the nasal septum there to help with the breathing. So she had this all done at once. She said it was the worst possible thing she's ever done in her life. She said it was just so painful. And it didn't take her a couple days or a couple weeks. It took her months to recover from this thing. I mean, it was bad. But as a result of it, her allergies bother her less. She's able to breathe better. It's not as bad. But yeah, I mean, she was a wreck, you know. And then I had a patient that did the same thing. Same doctor, same exact procedure, same recovery time. It was just.
Don't go to that doctor.
Well, I don't know. I'm guessing that's the normal recovery time. It was awful from what I hear. Okay, let's finish up with the last part of the lymphatic system here, and that is the lymphatic nodules. And basically what these are, all right, are just going to be these clusters of these cells, all right, with what's extracellular matrix? we're just going to toss in some protein fibers in there, a little bit of water and large molecules, ground substance, okay? So we're tossing that in, and it's just randomly all over the place in the body, okay? I mean, you'll see it in the liver, the lung, everywhere. I mean, they're all over the place. And what is their job, okay? Immune defense, all right? So if you get an infectious agent that enters into any of these organs, all right, we're going to talk about what happens here, all right, especially when we're dealing with these MALT structures here, all right? But think about this, all right? Your digestive system is where a significant number of your immune cells reside, because when you're eating food, it's not perfectly clean, all right? And if there's stuff on the inside of it, the outside of it, for example, I used to be a much different eater until I took microbiology, all right? And it's true, because I cook everything, I burn the heck out of everything. That's why I don't let myself cook meat. But E. coli, and E. coli, I can't remember, it was a specific strain of H7, no, it's E. coli pylori, but it's there was a specific variant for it, which got into hamburger meats at Jack in the Box. This was back in the early 90s, I want to say. And people were dying. Actually, kids were dying and really old people. And it caused this condition called hemolytic uremic syndrome, or HUS, which essentially liquefies your kidneys. It just liquefies them. And so what happened was, you know, when you look at ground meats, all right, you take meats and the bacteria gets on the outside. But when you turn it into ground meat, you take it and put it in a machine that grinds it up. And so it mixes the stuff on the outside with the stuff on the inside. So what they would do was this tainted meats got sent out to these Jack in the Boxes, mostly on the West Coast. I don't even know if there was a Jack in the Box on the East Coast at the time. But it gets mixed in, so you cook the outside of the meat, but it didn't kill the bacteria on the inside of the meat. It killed it. So what would happen, because kids and older people had a weaker immune system, all right, they suffered from it. Point being is, that's just an example of tainted food. So if you think about it, what you're putting into your body, your immune system has to function at high capacity all throughout the digestive tract. Well, we have these structures here, which are called MALT, and I'll show you that. Well, let me show you now. All right, which stands for mucosal associated lymphatic tissue. You're going to see these structures in areas that will have some exposure to the external environment. Gastrointestinal, yeah, food, liquid, okay. Respiratory, we're breathing stuff in. All right, genital and urinary tracts, same type of scenario. UTIs, all right, you can get from an external source entering into the urethra. All right, genital, intercourse, anything. All right, so all of these are associated with possibilities of an external pathogen gaining access to the internal region there. So here's what we did. When I say we, like I actually had anything to do with it. All right, we stuck just random lymphatic nodules along these pathways here, all through the GI tract, the respiratory tract. All right, in the respiratory tract, we call them Peyer's patches when we get to the ileum there. And there are these big globs of lymphatic tissue that have the cells there just waiting. And they're monitoring, because pathogens all the time, even if it makes it past the stomach digestion process and gets into the small intestine, all right, they're still trying to infiltrate the epithelium there of the GI tract. Same thing with the respiratory. They're still trying to gain access into the internal portion of our system, of our bodies, I guess you could say, try to penetrate through that epithelium. Well, just on the other side of that epithelium, we'll have these MALT structures there that are just waiting. All right, and they're going to wait in defense of those foreign substances. And if they gain access, then they pounce and wipe it out. It's really cool. So they're just randomly placed through all these different organs throughout your body. All right. So again, your immune system is really quite amazing, and also the lymphatic system, which plays a role, you know, as part of the immune system. But keep in mind, all right, when we talk about the MALTs, that is the mucosal associated lymphatic tissue there. Okay. All right, that's it for the lymphatic system. I want to jump in and start on the respiratory system. There we go. So let's pull this up. We'll talk for a few moments on the lymphatic system, and then we'll call it a night. Don't forget tomorrow your lab test, Thursday. Okay. So welcome to Bio 211, Anatomy and Physiology. So now just to remind you, whenever you hear me say structural, you're thinking what? Anatomy. When I say functional, you're thinking physiology. Okay, good. That's just a code word for that. So when we talk about the structural and the functional organization of our respiratory system, all right, it's important that you know, all right, which terms apply to which. So when someone says, I have an upper respiratory tract infection, all right, you'll know right away because you took this course, all right, that they're referring pretty much to the area of the superior portion of the trachea, the nose, the mouth, the pharynx there, all right? If they say I have a lower respiratory tract infection, then they're referring from the trachea on down to the lungs and whatnot, okay? So keep in mind that if you look here, my point for showing you this picture is we're talking about structural versus functional. The upper respiratory tract is smaller than the lower respiratory tract, but when we switch over to the functional organization, all right, and we break it down into the conducting zone and the respiratory zone, the conducting zone is far larger. The actual respiratory zone, that's where the actual gas exchange occurs. That's it. It's a very small area, right, when we talk about the functional aspect of the physiology. Physiology of the respiratory system is essentially just gas exchange. Carbon dioxide and oxygen moving across, all right, the blood barrier there of the capillary and the alveolar wall, all right? So we're going to talk about the actual mechanics of that in lecture, though. Okay, so talking about, and this is kind of a little bit of a review because we're going to get into histology here. And for those of you that hate histology, I'm sorry. All right, but when you look at the histology, it's going to make a little bit sense to you as to why there's certain types of epithelium located in certain portions of the respiratory tract. Okay, so first of all, right, a majority of our respiratory tract is going to have a mucous membrane lining. That's important, right? Mucous membrane. All right, it's going to trap foreign material. Especially if you live in the city, you're going to be exposed to that many more pollutants in the air. Okay, so it's important that we have mucous membrane there to trap it. And plus, if there's any infectious agents, we'll take care of it. Okay, so our mucous membrane is made up of our epithelium. We'll talk about the different types of epithelium. We briefly discussed it in chapter 5. But as we know, all epithelium except, all right, the epithelium, or should I say the endothelium of a lymphatic vessel, has a basement membrane. Okay, there's a couple other exceptions. All right, but epithelium is always going to rest on the basement membrane. Okay, keep that in mind. All right, underneath the basement membrane, we have what's called the lamina propria. All right, and
we got done
yeah, you beat me.
They got a test on Monday. In the mailroom, they have the new edition of textbook that will probably start using in the fall. And there's one there in the month.
It has, oh, thank you. All right, it's not even my birthday. Cool. All right. I just got used to this edition. Now I got to learn a whole new edition. You know what it is? Why? Money. All right. So, all right, when we talk about the lamina propria that sits underneath the basement membrane, it's made up of loose connective tissue. That's ideal because we want the diffusion. We don't want it to be a dense connective tissue. Okay, we want a nice loose connective tissue because we need the movement of substances here. So when we talk about the respiratory epithelium, all right, as we move from the nose, all right, and mouth down to the alveoli, it will become thinner. Okay, that's what we want because that conducting zone all the way down to the respiratory zone, we want the respiratory zone to be as thin as possible. Remember, simple epithelium is great for filtration, absorption, and secretion. All right, so in this case, it's going to be filtration. We're going to be filtering across the respiratory gases, oxygen and carbon dioxide. So that's what we want to see. When we get down, all right, to the simple squamous epithelium in the alveoli, all right, we want to see, all right, it to be as thin as possible. All right, up in our nose and our upper pharynx there, it's made up of a pseudostratified ciliated columnar. Well, columnar cells are nice and tall. Cuboidal cells are a little bit shorter, and squamous cells are just really short. Okay, so we're going to transition down this way. So we start off with the pseudostratified ciliated columnar. Why do we need cilia? What's the point of it? To what? To move? Yeah, what's it moving? Mucus. Remember, look. Mucosa, mucous membrane. All right? Goblet cells are located in pseudostratified ciliated columnar epithelium. They're also located in simple ciliated columnar epithelium. All right, so they make the mucus. Well, actually, freeze that. They make mucin. When mixed with water, becomes mucus. Okay. You also have other glands in the lamina propria that will also contribute to that. Okay. So we need cilia to move that mucus. Okay. So, and then we'll transition down further into the simple cuboidal and eventually into the simple squamous. Now, there's a couple areas where we're dealing with stratified squamous. Hey, remember stratified epithelium? That's the multi-layer thick epithelium, which is found in places of mechanical stress. All right, abrasion is a form of stress. Okay, so we're going to find that around the pharynx because guess what? You're going to be rolling food through your throat too, so we need to have some stratified epithelium in there. All right, and around our vocal cords there. We'll learn more about that later on. So check it out. Here's our mucosal, portion of the mucosal membrane here. All right, so here you can see, okay, here is the lamina propria, the loose connective tissue with our basement membrane, and then we have our pseudostratified, all right, ciliated columnar epithelium. Here's the cilia up here, and then you have your goblet cells, which are producing, all right, the mucin to help make this mucus. Okay, and that cilia will move it around, all right? It will move it towards the mouth. All right, or well, I shouldn't say towards the mouth. It will keep it away from the respiratory tree, away from the alveoli. You don't want mucus going down into the respiratory zone. All right, that's why whenever you get sick and you're coughing up sputum, all right, you're coughing it up. All right, you're getting rid of it, you're expelling it. So this picture here shows that progression here, all right, of how our epithelium becomes thinner and thinner and thinner and thinner. See how that works? Makes sense, right? I mean, physiologically, because eventually this is our filtration barrier. We want the gases to be able to diffuse nicely across this membrane here, or that epithelium there. You can also see here too, when we get down to the cuboidal, we actually have some cilia here. Okay, not so much, but we have some. All right. So when we talk about the mucus, our goblet cells are going to be mainly responsible for making that mucin, but we also have some glands in the lamina propria there. All right? And its job is to trap stuff, catch stuff, form particles, pollutants, whatever we can. We're going to trap all of this stuff in the mucus here, all right? Whereas at the same time, if any infectious agents infiltrate, well, guess what? Here it is again. Lysozyme, defensins, and then our antibody IgA. All right, that's located all in that mucus, in that line, that first line of defense here. So if you ever go to your doctor and you're complaining of respiratory issues, and well, they should ask you and you're coughing, they should ask you, do you have a productive cough? And that means, are you coughing anything up? And of course, if you are and you say yes, what's the first thing they ask you if you're coughing something up? What color is it? What color is it, and how much are you coughing up? All right. So keep in mind too, a lot of people think if you're coughing up green sputum, because that's what it's called, sputum, when you cough it up, that it's not always a bacterial infection. Everybody thinks that if it's green, it's automatically a bacterial infection. It's not. It's not. Don't be fooled by that. Okay, let's start off here with the nose and the nasal cavity here. Okay, so your nose, all right, aside from the fact we learned in 210, all right, is an organ, or I should say an organ, a structure for olfaction, your ability to smell. Okay, but it's also another structure that allows an entryway for air into your respiratory system. So your nose and nasal cavity have to prepare that air. They got to make it suitable for your lungs, okay? Because your lungs would much more prefer to have moist air than dry, arid air, okay? So when we inhale the air, it's going to actually travel through the nose first if you're not breathing through the mouth, okay? So if you recall, all right, in 210, all right, some of the structures there, all right, you have cartilage, well, bone. Remember the two bones that make up, all right, the perpendicular, excuse me, I just almost gave it away. The bony nasal septum, all right, that's the dividing structure that divides your left and right nasal cavities, all right? So you have hyaline cartilage, dense irregular connective tissue, and then skin that wraps over everything. The two bones that form the bridge of the nose are the nasal bones. All right, and then if we go more inferior and lateral to the nasal bones, that's where you have your hyaline cartilage structures, all right? And then further out, all right, more towards where the nose starts to flare out, you have two more pairs, all right, of alar cartilages. And then finally, just lateral to that, all right, you'll have that dense irregular connective tissue that's going to form the actual borders to the lateral portion of your nostrils there, okay? So if we look here, all right, you can see here are the nasal bones, all right, and then you have that hyaline cartilage which forms the lateral and anterior structure, all right, to your nose, all right, and then you have your lateral cartilage here off to the side, and then further out, all right, you're going to have your alar cartilage, and then here you'll have your dense irregular connective tissue that makes up the lateral portion of your nostril or the nares there. Okay. All right. Inside the nasal cavity, all right, you are going to have these openings here, all right, or these spaces which we call conae, all right. And so these conae are going to go from the openings of your nose all the way back to the nasal pharynx there. All right, so it's basically just the internal space there. And so when we're looking at the internal space, the floor of your nasal cavity is formed by your palate, the roof of your mouth, obviously, because your nose sits on top of your mouth. All right. Then if we go up to the bones that make up the nasal cavity, it is made up of part of your frontal bone, your ethmoid bone. All right, we're also going to see the sphenoid bones that sit more on the posterior portion here. And then you have your cartilage pieces there that we just talked about on the previous page there. But down the center of the nasal cavity is our nasal septum. Okay, and your nasal septum is made up of those two bones, all right, the vomer and the perpendicular plate of the ethmoid bone. And then it's also made up of cartilage, okay? All right. Let's pull this up here, and then I can actually describe this to you. So if you have your atlas ready, just to go through a couple things, and then I can go to the previous slide here. So here's your nasal cavity. This is the anterior portion. This is the posterior portion. In your nasal cavity, you have these three structures coming off of the lateral wall here. All right. Now, we saw the bones in Bio 210. You had the inferior nasal concha, the middle nasal concha, and the superior nasal concha. And these are bone-like structures. You're seeing them covered with epithelium now. All right. So structure 2 here is the inferior nasal concha. It's that scroll-like bone. Then right above it is the middle nasal concha, and then just above that is the superior nasal concha. And then underneath the concha, you have these spaces. And these spaces we call a meatus. So below the inferior nasal concha, number 5 here, that is the inferior nasal meatus. In between the inferior nasal concha and the middle nasal concha, all right, that space there is the middle nasal meatus. And then finally, that little space there between the superior nasal concha and the middle nasal concha, that is the superior nasal meatus. Then we can see actually a couple of our nasal sinuses here. Here's the sphenoid sinus, and then right above is the frontal sinus. Okay, so these structures here, okay, help to circulate the air. Because remember, we've got to prepare the air that you just inhaled for the respiratory system, for the lungs here. So those concha there help to kind of spin the air around, create some turbulence so it comes in contact with the mucosal membrane of your nose. So we can clear out any foreign particles or debris, and we can also make the air more humid. All right, so we don't dry out our mucosal membranes there. Okay, so the purpose then, all right, of the nasal concha is to create that turbulence in the air. All right, and as it's spinning around, all right, it helps to clean it, but it also helps to humidify it. All right, so just inside, all right, your nose, the nostril there, you have a small space there, okay? That's called the nasal vestibule. This is the area that for some folks, all right, especially in older males, their hair growth, for whatever reason, seems to get a little bit out of control. And this is the area that those hairs where they trim their nose hair, all right? We call that nose hair, all right, the vibrissae. I feel like that should be a name of a dessert or something, but it's called vibrissae, all right? So again, their job is to essentially clean the air, all right? It helps to remove some of the particles there. Back in chapter 16, we were talking about the olfactory epithelium. That was located in the superior portion of the nasal cavity there. And that makes sense because remember, you had your olfactory tracts that came down. They terminated on an olfactory bulb. And then that olfactory bulb projected, all right, cranial nerve 1 down through the cribriform plate of the ethmoid bone. And it would go through that cribriform plate there, down into the superior portion, all right, of the nasal cavity. It had these little hair-like structures on the end of them. And this was all encapsulated in mucus. So then you smell something, they call them odorants, and they would flow in, and then they go into the mucous membrane, all right, and then they bind on to these special proteins, and these proteins would then go to the ends of the olfactory neurons here, and it would stimulate. You probably all remember this from 210, all right? But that's located in the superior portion there, okay? Its job is for smell detection, all right? But now, all right, when we talk about, all right, the mucous membrane of the nasal cavity, all right, we are dealing with that pseudostratified ciliated columnar epithelium, okay? Has anyone ever here watched House? Remember that show? All right, that's the doctor that I always wanted to be. You know, he could be just brash and rude to people, but they still loved him. Well, I don't know if they loved him, but you know, he's like the doctor that you'd love to hate. I'll never forget there was an episode and this guy kept talking about getting nosebleeds and getting nosebleeds. And so I'm figuring, all right, this is going to be something like high blood pressure, or he's going to have some tumor. No, House called him out on it. He was a nose picker. He just kept picking his nose, and he damaged the pseudostratified ciliated columnar epithelium so much that the underlining capillary network, all right, was exposed chronically. That's how he was getting his nosebleed. So he's told the guy to stop picking his nose. I just thought that was funny. That was his medical advice. All right, let's do a few labeling here, and then I'll get you out of here. Okay, So, a couple things that we're looking at. Here, this big circle is indicating the nasal cavity. Okay, that's where we see all our concha there, right? Just in the anterior portion here, as you go up through the nostril here, all right, there's a name for that. That actual opening is called the external nair, all right? That is your nostril. In the area immediately surrounding the external nair on the internal portion here of your nose, that is the vestibular, or the nasal vestibule, that vestibular cavity there that holds the vibrissae, all those nose hairs, okay? So another sinus, here's the frontal sinus, here's the sphenoid sinus. All right, so you had an external nair, you also have internal nairs because, all right, the external nairs are the entrance into the nasal cavity, all right, while the internal nairs are kind of the exit from the nasal cavity down into the pharynx here. Specifically, this is going to be the nasal pharynx. Well, I'll show you that in a second. But you see this little opening here? Okay, and that's the opening to the pharyngeotympanic tube or duct. Y'all remember that, the eustachian tube? Remember, that's ear infections, straight up. All right, you get a throat infection. All right, it is very common, especially if you're younger. All right, because of that opening there, that the bacteria can crawl up and move up into that and go up and give you an inner ear infection. More common in younger people because, all right, the pharyngeotympanic tube, all right, in older people is more vertical. Okay, so things have to climb up. All right, in younger people, that tube is more horizontal. Is it easier to walk up a hill or along flat ground? Flat ground. So it's easier for the bacteria to move along that flat tube instead of going up. That's what. Look, that's one. I can't say that's why the only reason, but that's one of the reasons why. All right, younger, like especially babies, especially, are more prone. All right, to inner ear infections. All right, here we can see. All right, our nasal septum here. All right, we can see the bone that it's made up of. Here's the perpendicular plate of the ethmoid bone. Here's the vomer. And then you have your actual hyaline cartilage here at the anterior portion. Frontal sinus, sphenoidal sinus. This is showing us that nasal pharynx there. All right, as the oral cavity, as the nasal cavity starts to taper down, all right, we're getting down into the throat. That's your nasal pharynx. Here's your hard palate right here, all right, for the roof of the mouth. And then you can see back here, all right, we're not seeing bone anymore. This is more of a soft tissue. That's the soft palate back there on the posterior portion of the mouth. Okay. And here you can see, all right, the breakdown for the pharynx here. Okay, this whole structure from here down, well, that's already highlighted there. All right, number 13 is showing you, all right, the whole pharynx, which is made up of all these highlighted or colored areas here. All right, and then we break them down into their specific sections. The part that's posterior to the nasal cavity is the nasal pharynx. The part of the pharynx that's posterior to the oral cavity, that's the oral pharynx. And this part I haven't talked about, but this is the laryngeal pharynx because it is going to be around your voice box, your vocal cords, larynx. Okay? So those are the three parts that make up your pharynx overall. You can see it over here too. All right, that's it. I say we stop. I think your brains are full. You folks did a great job. We'll pick up here on Monday. If there's any questions, type away. Any questions at home? Any questions that you folks have for me? No? All right. Don't think so. All right, Morgan. Well, thank you. All right. Good night. I wish you all the best of luck on the test tomorrow. Okay. I will do my best to try to get them graded over the weekend. All right, everybody. Have a good night.